a narrative, I think, that's been developed by the alcohol industry, that it's about irresponsible drinkers. So therefore, if you can't manage this addictive product, then you are somehow irresponsible. You know, and I think that narrative plays out in the way that people are responded to when they go into healthcare services, when they access services. Lots of people who I've spoken to who are in recovery have said that first step of admitting there was something wrong was really difficult, because it meant that they had to acknowledge that they had the stigma that they somehow hadn't managed this product that everybody else manages.
Any alcohol policies at the moment, or reference to alcohol, the 10-year health plan, the men's health plan and other things, they talk about it from an industry perspective, in the sense that it's an individual problem. You know what I mean? It's not the infrastructure, it's for people to do things about it themselves.
If you look at the way in which tobacco policy is protected by the Framework Convention for Tobacco Control, you need something like that for alcohol. I would say you need something like that for all the, you know, the real harmful public health agendas.
We took they weren't called the best buys, but we took them to Scottish politicians, and they were attracted by the idea. So we talked them through price availability marketing. So the minister responsible said to me, really interesting, you know, meet again to talk about it, but I'm meeting the industry next week. And I said, well, I'll tell you what they're going to talk about. They'll talk to you about underage drinking. They'll talk to you about drink driving, one sober driver, problem solved. And they'll talk to you about drinking in pregnancy. They won't talk to you about men. They won't manage chronic health harm. And two words that you won't hear, one is supermarkets and the other one is vodka. So we met 2 weeks later and they said, you were absolutely correct. That's exactly what they talked to me about.
Policy battles, if you like, or it's a battle between interests and how you want to serve those interests with ideas. And obviously industry comes from one place, profit. Public health comes from another place in terms of protecting and improving health. I think locally you can put guidelines into place which sort of prevent industry having input into health.
The industry has access to civil servants. They expect to be able to ring up and have a conversation and to meet with and, in brackets, be influenced by.
Actually, the world around us has been shaped by the industry. They have millions and millions and billions of pounds more than we have to be able to balance that. And I think governments have a responsibility to try and level out the playing field so people do have a bit more of a free choice without walking around the corner in the supermarket and seeing the alcohol advertising next to the back to school display, without, you know, looking at the no and low alcohol next to the really strong beers, without going into the cinema or going into a soft play and being served alcohol. You know, we are not in a place at the moment where we have free will in the way that we behave.
But the other thing is, across government, how industry is seen. We view them in one way. For government, their economic growth is the game in town. They are part of that.
That narrative of responsible drinking is something that we absolutely have to challenge, because it is an addictive substance. You know, it is something that we should be controlling in a different way to protect the population.
Every time the UK signs a trade deal, I can guarantee there is a minister in a Scottish distillery promoting Scotch whisky. So, you know, they're big employers, and I think we have to remember that. They are, you know what I mean, part of the economy. So you're not going to dismiss the industry, but how do we protect health from industry?